Welcome back to I'm Still Here. I'm Larry.
And I'm Heather. In 1998, I was diagnosed with stage 4 breast cancer at the age of 26. It changed everything for us, but I'm still here.
You are?
Yeah.
So today we are, excuse me, going to be talking about healthcare providers and all sorts of healthcare providers. And I hope by the end of this is something that you at home, as maybe a survivor or someone going through treatment or someone just newly diagnosed, you can hear these things and relate to these things, and you can go to your healthcare provider and you go, you should listen to this. Seriously.
Yeah.
Because you are a healthcare provider for one thing.
I am, and I know that my experience has really impacted the way that I see the people in front of me.
It has to, yeah. But I gotta believe that 98% of healthcare providers are not thinking about the patient in these ways and the words they use in these ways on a daily basis.
I agree. I think sometimes we let people off the hook because it's like, well, I can't be that involved all the time. But you know what? It's not about being that involved. It's just about being aware. So it's funny. I thought of like when I was thinking about talking about this, I'm like, from my perspective as a patient, it's like, see me as a person, and understand what I'm going through. And then, also when I was thinking about it, it's kind of like the whole, there's kind of like you have an opportunity to be a hero or a villain as a healthcare provider every day. Yeah. That sounds, I'm not overemphasizing that. I just wish people could really understand. For one thing, every day that people walk into a hospital or a cancer center, it's not a normal day for them, right? Things are very heightened on the part of the patient already. So, yeah.
Yeah, and I can relate to this from a teacher-student standpoint.
Sure.
Because there's a lot of similarities here.
Yep.
And, you get caught up in what you're doing as the teacher or the healthcare provider, and you have goals.
Yeah.
And the goal is, in my case, to teach something, in their case, to scan something or to diagnose something or to whatever. And that's the goal. It's bad to say, but you become less of the goal.
Yeah.
I mean, you know what I mean?
Sure.
And sometimes you having to really think about your words or other things like that, sometimes it detracts from that. I know it's bad to say, but healthcare providers are humans.
Yeah.
They have crazy lives too.
And crazy productivity. And I get that. There's, life, it's, yes, they have things going on outside of work, but also work is like a let's go. Yeah. Especially in America. I don't know. Might be different somewhere else.
No, it's so true. And I've got to believe that you guys listening, especially that have gone through treatment, you have some things that are stuck in your brain forever.
Yeah. Because
of what somebody did or said along the way. Mm-hmm. They will never go away. They will be there forever. Yeah. So, and I know you have.
The first one from a negative standpoint is get your affairs in order. I'm going skiing. We can try some treatment when I get back.
For those just kind of listening for the first time, what are you talking about?
So the first oncologist that I met literally was so angry that he had to deliver the news to me, and it wasn't my primary care physician.
Right.
That he came in and he said, get your affairs in order. Mm-hmm. I responded with, I'm 26 and that's the best you can do for me. And he said, well, we can try some chemo when I get back from skiing, but I'm not making any promises. Like,
yeah.
Whoa.
Yeah. Well, I remember. I couldn't breathe at that point.
Whoa.
And that's an extreme example, I think. We're going to get to, I think, some less extreme things that maybe would I got to believe that doctor, if confronted with what he said, I got to believe, just because I believe in humanity, that he would be like, oh my gosh, I said that, and oh geez, that was just horrible. I gotta believe that. I hope that, because that is just out there. Everybody listening to this would go, you got to be kidding me.
Yeah.
There are other things, though, that I think people can do or say that would go right over their head. Not even when confronted, they'd be like, whoa, I never even thought of it.
I think some of those things, like you're talking about going over your head, is even just as a patient and a person that knows myself, it's okay for me to interject to a healthcare provider like, whoa, slow down, or stop, or I don't want to hear that, right? Even being able to go, I know this is your norm to come in and like talk about results or do all this stuff, but for me, it doesn't feel comfortable. So I think one of the things that I am really good at is advocating for myself and setting boundaries with healthcare providers. And I think honestly that a lot of people, it goes so fast that they don't even think about it, but they remember how they feel afterwards, right? So sometimes it really is the little things too, like, oh, somebody slipped in a little tidbit of information that you go, wait a second, did they say that I'm, and you go, that's the stuff that you remember when you're lying in bed at night. It's terrible, but.
Or it's awesome.
Yeah. So on the flip side of that, I mean, I'll, drink some green tea, eat some fruits and vegetables, and we'll start killing cancer on Monday. These two things that we're talking about right now happened within 24 hours of each other.
Yeah.
The difference in empowerment and hope and everything else is astounding. And was it that much harder? Like for the provider, for, my oncologist, she's still my oncologist now, just to be able to kind of throw me that lifeline instead of, I just kind of feel like, I guess too, especially with delivering tough news, it's not your job to be so brutally honest that...
I don't know where that came from. I really don't, because
I don't either.
And I talked to some doctors and we, and family and that kind of thing. I don't understand where no, you just have to give it to them like the worst. This is what
I'm going to give you the worst possible news, and maybe I'll throw in there. Why?
I get that you should not lie to patients.
Absolutely,
I understand that, but what is the downside of taking the positive road and possibly giving someone hope if they want it?
I have no idea.
Because not everybody wants that. No. Okay, but you still, with that, drink some green tea and we'll start killing cancer on Monday. How can that ever be a negative to anyone? I don't get it.
It wasn't like go out and get drunk. Like there's no negative to it. Exactly.
So if you're a physician, oncologist, and I know you get bad news every day, think about how you give that, and always give hope.
And see the person, see them. That's the other thing, was my oncologist, before the green tea and all, she asked about me. Mm-hmm. She was painting a picture of who I am as a person.
And I know why now, because I know her.
Yeah.
She, you were 26, first of all, but she wanted to know, number one, do you really want to fight this? Because she knew the percentages. Yeah. She knew the odds. Yeah. She knew what uphill battle this was. And number two, she wanted to make sure you had a support network. Yes. And what that support network was, and were they going to be there for the long haul? She asked these very pointed questions even to me and your mom. And like, you kind of got a job now, and this is your role. And she was very specific about that. And she wanted to know that I don't know this next part, but I think before she truly invested in you as a person, not just a patient.
And honestly, I guess the other thing with that is it's okay. It's okay to say, I don't want to do this.
That's why I said give hope if they want it.
Right. I love that, I think it's as important to find out where your patient is coming from. I've worked a lot with elderly patients, and I see them. They're tired, and they feel very content with the life they've lived. And, and pushing more is also not the answer, But
I gotta believe if I'm whatever, I'm just gonna say older.
Yeah.
Because I don't know. I'm older now than I was, and I still feel like, oh no, I'd fight.
Right.
But maybe there is. I can absolutely see a day where I'm just like, no, I'm good.
Yeah.
I've had an unbelievable life. I'm good.
Yeah.
And this is how it's gonna go.
So, not to just focus on oncologists or on doctors,
Sure.
we also wanted to talk a lot about, also about the other people in the hospital.
Yeah. Because
the oncologist is a small percentage of who you spend your time with.
That's exactly where I was going there. That's who you see all the time. It's kind of like, right.
And also, I think, I'm good at preparing myself for an oncology visit. Mm-hmm. Sometimes I stroll into a PET scan, having been really living my life, and then it just smacks me in the face. Right? And then, that scanxiety hits, which is just that, again, it is so important for people in healthcare to realize that the anxiety around knowing that a test can change your life is very challenging for people to deal with.
And therefore,
yeah.
Their words, their actions are unbelievable. Can you give us a couple of examples? Maybe of both. I don't know.
Yeah, well, one thing I've mentioned a few things before in terms of, I hate it when I'll fill out a form about my previous history. And again, I'm like, you have to have my history at this point. But I'll fill out a basic form, and then a tech will come out and say, have you ever had a PET scan or a bone scan or whatever? And I'm like, what was the point of me just filling out that form? It just makes me, again, feel very unseen. And also it feels a little bit like they haven't even done the very, very basic part of their work. I work in healthcare. I understand productivity. And I understand, even with all of the way charting goes, not really having a good picture, but you can ask a better question. So just ask me, I see you've had this procedure in the past. Is there anything you have a question about today? Or how's it going today? See me, and
You're a person,
I'm a person.
Not the next patient.
Yeah, not your next 15 minutes.
Yes. It's so important.
But on the flip side of that too, there's some things that you can do in those situations where you can really increase the level of comfort and making a person feel seen. Things like, for me, asking about a smaller needle, or if I ask about the small, can you use a smaller needle, saying, yes, I can, or no, not, because, being willing to consider my needs. I'm not an easy stick anymore. That's asking if I have additional tests going on that day. I've had it in the past where I've literally had an IV put in, and then I've, had it taken out, and then gone to the next thing, and they're like, oh no, we need to put an IV in. Mm-hmm. Like, come on, that we can look at that, and honestly, you can just ask the patient, and if you know more than I do, a lot of times as a tech, you will need an IV for that, so let's keep this in.
Yeah.
I love that people do that now.
And I do think there is a difference between a cancer patient and other patients.
Yeah.
If I need to go in to get an x-ray because I think I broke my ankle, I don't care how you talk to me. I don't care if you even talk to me. I don't care whether you know my name. I don't care if you're rude, to be honest with you. I don't care. Because I'm not fighting for my life. This is a real life and death thing. This is a difference in patients, and they need to understand that, and they need to acknowledge that.
Acknowledge it, and also don't be talking about your life and what you're doing on the weekends behind me, please. But also, there's this fine line, too. Don't look at me with pity. I am, going to be wrapping things up soon. Mm-hmm. So, I guess Nuke Med is kind of, I've always said, kind of my nemesis, right? Because I've had a lot of bad experiences there. The other things I've found are also just kind of procedural. Really make it be known that if your procedure, you can't have any metal on, like put that in bold print on whatever it is that a person is getting, a text or in their portal or whatever, saying wear clothing without metal so that you don't have to jump into a gown. Like nobody feels comfortable in a gown. And that also, for healthcare providers, it kind of does the whole blank slate. You're just a blank patient, not a real person when you're in a gown. And then one of the things that I have fought more recently has been like positioning on the table. So there's some tests that I do where they want my arms above my head. Well, after 10, 15 minutes, your arms are falling asleep. And I just find it really uncomfortable. And then I've also realized that my arms don't have to stay above my head, nor do they even sometimes have to be there. And so just because that's
their procedure
for everybody, because everybody fits in the same box, doesn't mean that's what's best for patients or for me individually.
And you found a lot of these things out. How?
By advocating for myself, honestly, or by pushing the norm, by saying, they would hand me a gown and I'd be like, I don't have any metal on. Oh, okay, I guess you could wear your clothes. Or, saying, or just looking at the scans, you go through them. You can literally watch your image. Okay, my arms are, this part of me is done, the top part. I'm putting my arms down for the rest of my body.
Yeah. Right.
I don't know. It's things like that. But there's just a million ways.
I think if all of the techs in every area of doing tests.
Yeah.
I think if they all ran their mother through these tests, they might change a little.
I think honestly,
or a loved one.
Yeah, I would like, and maybe it's happening somewhere, but I would like these programs. I don't think the techs themselves are ever on the machines. Get on a machine for 20 minutes. Put your arm above your head. Tell me how it feels.
I'm sure a lot of them have, to be honest with you. I bet a lot of them have. That have been in the field for a while. Maybe not brand new. And I don't know, maybe they do in school. I
don't know either.
Yeah, but that's a great point.
Yeah, so...
The empathy part.
And just... those are tough times for cancer patients, being in the hospital. And also, sometimes it can feel so hard just to advocate for yourself again and again and again. One of the other things I was thinking a little bit about, like, is scheduling. A lot of times, your doctor will order these different things, and then the person scheduling will be like, well, you're going to do this at this time, and this at this time, and this at this time. And it's like, wait a second, like, when am I going to be able to go to work?
Yeah.
Or, for me, with my cancer center, it's 2 hours and 15 minutes away. So there's been times that I've gone down after work and done things, but being aware of what patients' lives look like and being able to say, oh, we could do this test with this test. I get it. Sometimes you can't do things together, but really bundling things in a way that makes sense. But, doing testing prior to appointment times. There's been times in my life that the results haven't even been done when I'm seeing my doctor.
A lot of times.
That's ridiculous to me. I don't care so much about lab work, but because that's not been a huge thing, outside of chemo. But, just a lot of those things can make a big difference. But if you're in healthcare, no matter what your role is, you have the ability to make somebody's day better or worse.
And even if, you're the, I don't know if it's the right term, the secretary, the person that checks you in, the receptionist. Yeah, sorry about that. That person, you're setting the tone of their day.
Yeah.
And so many people I know come in being lost or being because
or worried about the parking changes.
Or these, you can just change the tone and they will remember you that day. And it's huge.
Same with I think about like the CNAs who help me with the days that I was struggling to stand up, and were like, rather than like, oh, come on, it was like, do you want to try it again? You know, and making things a little fun. Or the people in my journey who have been like, I had a nurse who said, you're my age and I'm with you on this. And that didn't cost her anything, you know.
And those words. So this is 20 some years later. And you got to understand, these words are fused in her brain forever.
Yeah.
And a lot of them are positive. A lot.
I mean, we are clobbering the cancer. Yeah. I'll never forget that.
You know,
from Dr. Remember.
Now, I would also say to you guys listening that if you have those, especially if you're in treatment right now, write them down. Write down every positive thing that people, make it into your quote. Make it and just post it. Put it on your bathroom mirror. Put it in your car.
That's where Every Day We're Killing Cancer came from. Yeah. Is, you know, we'll start killing cancer on Monday. Like,
you want to go back to the mental side of, yes, we're in charge of our own, mental aspect and how we run our day, but people affect it, both positively and negatively. And when you're spending so much time in a hospital or with, the healthcare providers, you guys just, you have an opportunity to do great things.
And honestly, as a healthcare provider myself, it's the connections that I've made over time that I also remember. It's the stories, or making something. I'm an occupational therapist. I've worked a fair amount in nursing homes. Generally, a lot of my patients aren't thrilled to be in a nursing home, for one thing, but also skilled nursing facility. But also, they're tired and things are hard, and being able to hear parts of their stories and just taking a different approach, being compassionate about the situations they're in, all of those things are what make me want to do it more.
So the flip side of what we're talking about here is, as a healthcare provider, you can have those positive things
absolutely
that you were able to tell, or the patient shared with you, that stay with you forever.
Yeah.
Those things, like, you have both sides of this.
Yeah.
And you can tell stories about 25 years ago of what a patient, interaction with the patient, and how they've been impacted. So we have these opportunities in life, and I have a ton of them because I get new kids every year, and it's new opportunities for a similar type of thing that's not life-threatening.
Yeah.
But it's still the same story, though.
Yeah, we're all people, and we need connection, and we want to be heard or seen. And sometimes being seen is like, I'm not up to talking today as a patient, or I'm just gonna, let me get through this and move on, please. It is kind of using your spidey senses of
mirror neurons.
Thank you, spidey senses.
Mirror neurons.
to pick up on what the patient is laying down in terms of, and sometimes you have an opportunity to make that better.
Mm-hmm.
And it really can just make all the difference. So I don't know what we'll call this episode, but we want patients to be able to feel like they have a say.
Yeah.
And that you shouldn't have to feel like you have to settle for a negative experience in order to get the right things done. And likewise, we want the healthcare providers and the nuke med techs to know that we're watching and listening, and it.
Because you guys have all heard, if you're a healthcare provider or if you're listening, you've heard this before.
Yeah.
This is not the first time. You heard this in school. You've heard this from a conference. You've heard this from maybe patients or from somebody who trained you. You've heard this.
Yeah.
I've heard this as a teacher. But until it sinks in and you every day go in going, okay, I got an opportunity.
Yeah.
Then you may be making a difference, but it may not be the difference you want to make.
Right. I would just say, don't hide behind, well, I'm busy, or I'm this, or, I get it. I understand that things can be stressful, but, it's still an opportunity.
Mm-hmm. So I would love to, you guys listening, especially those of you who've been through, treatment or had these run-ins or these opportunities. I'd love to hear yours.
Yeah.
What are the quotes that you remember? What are the stories that you remember? please share it with us because I know you got them.
Yeah.
Whether it was positive or negative, I hope there was a ton of positive, but I know the negatives stick with us too. So
Well,
I'd love
and
to hear
that's
those.
yeah, we would love to hear it. I mean, if when I think about a dream job, it's really talking with people in healthcare about the impact that their actions and words make.
Yeah,
That is it.
and you've had an opportunity to do that multiple
I
times.
have. I've done that some, and I'm always welcome that opportunity to be able to just reiterate. I am a patient, and but I'm also a person.
It's a person.
I am a person, and I do have people. Yeah, it's a big thing. Sometimes we get lost in the just kind of the numbers and the day to day of things. So,
And I think a big, maybe not, I don't know if it's a reason, but a big, reason that got you rolling down the right path was the whole, drink some green tea. We'll start killing cancer on Monday. And I think that's a big reason why you are
still here.
Good work. Hit it, Ty.